All right, hello everybody. Dr. Goforth here at Cornerstone Physical Therapy at our Woodfin location. Today I'm going to be talking to you briefly about vaginal weights. So for some of you that may be something weird, you've never heard of that term before in your life, I would backtrack and say if you haven't ever heard of Kegels, the vaginal weights are a progression of getting your pelvic floor muscle stronger with your Kegels. So just to briefly say, a Kegel is just a contraction or a muscle activation of those pelvic floor muscles that sit around the urethra, vaginal canal, and the rectum. So it's like a tightening and a lifting action. You can look at some of our other videos where we talk about those more. So vaginal weights, you can think of it kind of like a weighted tampon if you're a female. So you're inserting something, most of them have some type of string-like attachment on the end so that when you're done practicing with them, you can easily remove them. So the main thing I wanted to talk about with those is when is it appropriate to use them? When is it not? What are the benefits? So I would say if you're having some type of pelvic floor issue, let's say it's urinary leakage, fecal leakage, something along those lines where you're like, hey, I think I need to use those, or I just had a baby, I want to make sure my muscles get back up to par, I would still caution you and say first go see a local pelvic health therapist because it is dependent on the individual. It's best to know what is the current status of your pelvic floor. If it's weak, it might not be appropriate yet to progress to the vaginal weights. You can think of them kind of like dumbbells for your pelvic floor. So first, go get checked out by a local pelvic health therapist. We're here in Woodfin. We have more pelvic health therapists at our Arden location. If you don't live in the area, there's a couple websites you can look up a local provider like Herman and Wallace or APTA and type in your zip code. But moving on, back to what we were talking about. So you get checked out, you see what the status is. It's really up to the therapist's call, but at some point when I progress my patients to vaginal weights, it's, let's say I was seeing someone for urinary incontinence or leakage. They're getting better, but now they're an athlete and they're still noticing it with back squats as they're like adding weights or running. And when I test their muscles, they feel pretty darn strong, so it's time to progress them. So that would be around about the appropriate time. There's different sources. You can buy them off of Amazon, a local medical provider's website like Current Medical Technologies. Another scenario though that I would like to point out, some of my patients have a lot of difficulty feeling their Kegels. And so even though they're not even that strong to begin with, I sometimes recommend them getting a set of vaginal weights and practice with them in a lying down position so gravity's not fighting them, just so that they have something to contract those muscles around and feel a little bit better of what they're doing. So those are the two main scenarios: when it's time to progress because someone's kind of maxing out on their Kegel strength without weight, or if sensation is an issue and they just can't quite figure out how to engage those muscles. Those are the two most common situations that I'll recommend my patients getting those. So that's it for now on vaginal weights, and look forward to talking to you guys next time.